First aid training. What is first aid? It is a quick help to ease an injured person before they can get to medical assistance. It aims to preserve life, to prevent further harm, and promote recovery. A good aider must be gentle, resourceful, observant, tactful, emphatic, and respectful. There are also hindrances in giving first aid, just like unfavorable surroundings, the presence of crowds, the pressure from the victims or relatives. One way of giving first aid is bandaging. It is to create pressure over an area, to immobilize a part of the body and restrict its motion, to support and protect wound from contamination, to reduce a bleeding or edema, and to secure a splint or dressing. Here's a step on a head-top bandaging. First, fold the base at least 2 to 3 inches. Place folded base aligned with eyebrows. Pull back and cross over at the back, tucking apex beneath. Pull both ends in front to secure with a square knot at the center of the folded base and tuck ends. Pull down apex. Tuck apex neatly at crossover area. Here is also the steps for cravat bandage for the cheek or ears. Use the wide cravat. Start with the middle of the cravat over the compress covering the cheek or the ear. Carry one end over the top of the head and the other under the chin. Cross the ends at the opposite side. Bring the short end back around the forehead and the long end around the back of the head and tie them down over the compress. Cravat bandage for the eye. Lay center of the first cravat over top of he with the front end falling over uninjured eye. Bring second cravat around head over eyes and over loose ends of the first cravat and tie in front. Bring ends of first cravat back over top of head, tying there and pulling second cravat eye up and away from uninjured eye. Cravat for the knee. Start on the top of the knees, cross over and twist 2 to 3 times under the knee, cross over on top, pull ends to opposite sides and secure with a square knot under the knee. Here are the first aid treatment for wound. First, clean the wound with water, stop the bleeding, protect wound using antibiotic creams, raise limb above the heart, and cover with the bandage. When to visit the doctor? When wounds in a dip, has dirt in the wound, when there are signs of infection, when it is a bite from a human or any animal, and a wound on the face, you have to visit a doctor. Basic life support. The meaning of basic life support is be basic what any man or woman can do, and LS life support actions done with the aim of prolonging life of a dying person. These are the basic CPR steps. First, check area for any dangers. Check if casualty is breathing. If no response, position your hands on casualty's chest. Interlock your fingers. Press down hard, compressing the chest for 30 counts. Open the airway by tilting the head back and chin down. Give 2 rescue breaths. Watch chest falls and repeat compression and rescue breaths until professional medical help arrives. That would be all, and my name is Honey K. Basilo.